Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. This Wednesday and this month in general, we've been talking about the importance of sleep for health. And many people take medications either to help them fall asleep or to stay asleep. And today I'm going to answer a few common questions about sleep medicines. So let's get started. But before we get into it, if you haven't already, please hit the subscribe button. It helps us get the word out so more people can get this information. This is Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine doctor, and I believe lifestyle changes should be the foundation of medical treatment. I'm the owner of In Touch Primary Care in Sugar Land, where we offer stress-free health care with direct access to the doctor so our patients can get the care they need without inconveniences or delay. You can hear more about us on our website. You can learn more about us on our website, www.intouchprimarycare.com. So whether you're a current patient or you're just seeking to learn more about how to improve your health, these series are perfect for you. Sleep is so important. And insomnia, which is a sleep disorder that is very common, basically means that a person is finding it difficult to either fall asleep or stay asleep. And there are many causes for this. Sometimes it's stress related, but sometimes there's something more going on. It could even stem from something that happened in childhood. It could stem from just not feeling safe. So there are many things that can cause insomnia. And when it happens for just a short period of time, like a few days or weeks, it's called short term. But if sometimes it can be long term, and it's called long term if it's persistent for more than 1 month. So insomnia is something that affects a lot of people. So actually, the first line therapy for insomnia is something called cognitive behavioral therapy for insomnia. So not medication. And it's actually very effective. Basically, it's a form of therapy that examines the connection between the way we think, the things we do, and how we sleep. So the therapists will help you identify thoughts, feelings, and behaviors that are contributing to your symptoms. And it's about 6 to 8 sessions. And these are things you can actually do online. It's more convenient, and cognitive behavioral therapy for insomnia is something that can be very helpful. Sometimes you can do this with medication or without medication, but should be actually first line for insomnia. So that's the first thing. So let's get into some questions. So first question, is it safe to take over-the-counter sleep medications daily? So over-the-counter sleep medications usually come in combination. So things like Tylenol PM or ibuprofen PM, things like that, right? And all of them will contain one of two ingredients, the pain medicine like Tylenol, ibuprofen, and diphenhydramine or doxylamine, which are the sedatives, the things that actually make you sleepy. So a few things to look out for, though, is it's important to look at the actual ingredient of the medication because sometimes some people overdose mistakenly. So, for example, if you are taking Benadryl for allergies, for instance, and then you want to sleep, and then you take Tylenol PM, which has Benadryl, so you're pretty much taking too much Benadryl by doing that. The other thing is sometimes people add on things like or drink alcohol at night or are taking another medication that has a sedative. Maybe they're taking an opioid medicine or something else, and then you're getting, you're affecting, you're getting too sleepy because you're taking too much medicine. So even though it's over the counter, it's very important to be careful with those medications because, again, they're combination medications sometimes. If you're taking something else, you may be overdosing. Sometimes you are mixing it with other things, which can cause problems. The other thing to be aware of is that when you take it long term, so there are some people that have to take it every day, that is a problem because you can build what we call tolerance to it. So that basically means that you are taking it, your body gets used to it. basically. So it's causing you to build tolerance, and you would need higher and higher doses of the medication. So it's not a good idea to use it long term. If you're finding that you have to use over-the-counter medication long term to sleep, then you may want to consider definitely seeing your doctor about that. Okay. The other thing about over-the-counter medications for sleep is they can actually lead to confusion and delirium in older adults. So it needs to be used with extreme caution in older adults, or not used at all without, checking with your doctor. So that just, even though it's over-the-counter and they are FDA approved, it's still important to be careful with them because they can cause problems if taken incorrectly. Okay. The other thing about sleep medication is there are other medications that can affect sleep. So things like stimulants, for people that have ADHD, for example, may have to take a stimulant, and that can affect sleep. So taking it earlier in the day can help. Things like steroids can cause people to have sleep problems with sleep. Like, for example, you're taking prednisone for sinusitis or some kind of infection or condition that can, if you're taking that at night, for example, or even during the day, can affect your sleep. And even some antidepressants can affect sleep. Things like diuretics, so people taking medication for blood pressure that contain diuretics can have trouble with sleeping because they keep waking up to use the restroom. So some things like lowering the dose of the medicine, or choosing a different one that's shorter acting, or taking the medicine early in the day may help. But it's just knowing that, some medications can have this potential side effect. And so talking with your doctor about that. So what about melatonin? So the important thing to know about melatonin is, first of all, you want to talk to your doctor about this, but melatonin really drives the timing of sleep, not really the process of sleep. So if the issue is that you're waking up a lot, or you're not able to fall back asleep, then melatonin probably is not as helpful. It's more for people that are having trouble falling asleep than the other things. And then there are other things that can help with the augmented melatonin, like vitamin B6 or magnesium. However, again, that's something that you want to talk to your doctor about. Okay, prescription medications. Yes, so there are several prescription medications to help with insomnia, and there are several classes of prescription medication that can help. But it really depends on what the issue is, right? So for some people, it's probably trouble falling asleep, so sleep onset. For other people, it's trouble staying asleep. For other people, it's both. So the medication that is chosen depends on what the issue is. If it's the problem of falling asleep, there's certain medications that will work better for that, versus if it's a problem with staying asleep, or if it's a problem with both. So at the end of the day, knowing that all of them do have potential side effects, so it's important that this conversation is had with your doctor and it's personalized to what's going on with you. At the end of the day, though, you always want to use the lowest effective dose, and it's important to combine it with cognitive behavioral therapy, because that will hopefully reduce your need for medication in the long run, or maybe you can get off the medications eventually. So just speaking with your doctor about doing that as well can be helpful. So I hope that helps. Sleep is so important. It's good for your health. If you're not getting adequate sleep, don't ignore it, because it's a huge part of a healthy foundation. Healthy sleep drives healthy eating, drives your energy levels so that you can do the physical activity, drives you reducing stress. So sleep is a huge part of a healthy foundation. So if you're having trouble sleeping, don't ignore it. It can really, make a difference in your health. So if you found this helpful, please do not hold on to it. Go ahead and share with others that might need it. When you share our videos, it helps us reach a wider audience, because you're telling other people to check it out as well. So take a moment, subscribe, share, like our videos. It's a small action that can make a big difference. And I thank you in advance for your support. All right, if you're in the Houston area and you're looking for a doctor who's proactive about your health, we're here for you at In Touch Primary Care. You can learn more about our services and how we can help you by visiting our website, www.intouchprimarycare.com, or you can call us at 713-280-9985. We look forward to helping you on your journey to better health. Take care.